A new round of aid from Beijing to Sierra Leone. 59 lab inspectors are carrying all necessary appliances, including detection reagents developed by Chinese Center for Disease Control and Prevention.
The
government of Sierra Leone will enact a 3-day closure from the 19th to 21st as it attempts to stem the spread of Ebola. All residents are to stay home, and more than 700 inspection teams will travel door to door to inspect and locate those suspected of infection. Our team is expected to assist in inspecting the samples collected.
The inspectors will work at the Sierra Leone-China Friendship Hospital in the outskirts of the capital, Freetown. Some of them assisted efforts to combat the spread of SARS more than a decade ago.
After the SARS outbreak in 2003, China had taken a series of effective measures to control pandemics, including the bird flu. The Beijing Xiaotangshan Hospital was particularly successful during that time, as it erected in a week more than 1,000 isolated beds for observing suspected infected people. China is applying lessons from that crisis. It is now sending the core force of those medical staff to Sierra Leone.
The WHO is calling for global efforts to control Ebola as the epidemic has showed no signs of abating. Half of the 4,000 afflicted have died from the deadly virus.
China's announcement last week of 200 million RMB's worth of support to the worst affected countries was a particularly important step. And now today's announcement of a medical team of 59 people with a mobile laboratory for Sierra Leone is a particularly welcome step. WHO welcomes that support very strongly. Identifying people who have become infected with the virus is a very important part of the response right now, and that's what the Chinese medical team will contribute directly to.
These inspectors are expected to stay in Sierra Leone for up to 2 months. The addition of the team brings the total number of Chinese healthcare workers sent to West Africa to 174. 吴国修 CCTV 北京